We did a very large study in 2023 to find whether COVID-19 vaccination is associated with sudden deaths. COVID-19 vaccination is in fact not associated with sudden deaths. On the contrary, what we found that COVID-19 vaccination offered protection against sudden deaths. So people who received COVID-19 vaccination had a lower risk of dying because suddenly or sudden deaths. So one important message I would like to give is that our study, which is a fairly large study conducted across 47 centers in India, indicated that COVID-19 vaccination was not associated with sudden deaths. We did a very large study in 2023 to find whether COVID-19 vaccination is associated with sudden deaths. And so what in this study what we did was about 800 patients of sudden deaths who died because of sudden deaths were included, and about 4 times of control, about 3,000 controls were included in the study. And so the findings of our study indicated that COVID-19 vaccination is in fact not associated with sudden deaths. On the contrary, what we found that COVID-19 vaccination offered protection against sudden deaths. So people who received COVID-19 vaccination had a lower risk of dying because suddenly or sudden deaths. We also identified other risk factors that were associated with sudden death. And that included patients who had severe COVID in the past, those who required hospitalization because of COVID, those who underwent unaccustomed exercise 48 hours prior to their death. Similarly, those who were binge drinkers, and also those who had family history of sudden deaths. These were the important risk factors. So one important message I would like to give is that our study, which is a fairly large study conducted across 47 centers in India, indicated that COVID-19 vaccination was not associated with sudden deaths.
It has been said by Karnataka Chief Minister that due to COVID vaccination, sudden deaths, attacks, heart attacks have taken place, even more than people have died, and the younger generation people have died in this. What do you want to respond to that?
Yeah, I mean, I heard about that news yesterday, about 20 odd cases or 20 odd sudden deaths in one district in a period of about 2 months. And I also understand that the government of Karnataka has constituted a high-level committee of experts, including cardiologists. And I think they would investigate the matter and they will find out what were the reasons for sudden death. I think let us wait. He also has mentioned that this committee will give its report in 10 days' time. So I think let us wait till the report of committee comes. But only thing I can say is from ICMR study, which was conducted about 1.5 years back, COVID-19 vaccination was not found to be associated with sudden deaths.
Whether new survey need to be done on COVID vaccinations?
I mean, COVID vaccination as such surveys may not be required, but we, ICMR, conducted 4 surveys to find out what proportion of India's population was exposed to COVID-19 virus or SARS-CoV-2 virus. And such survey now may not really be required because we know that even the following once vaccine was introduced, almost everybody in India received vaccine, and therefore doing another survey at such a scale to find out how many of them have antibodies may not really be necessary.
So can we get the numbers of COVID cases in India at present, sir, and how is the situation?
Yeah, again, like when COVID pandemic came, counting every case was important because once you identify every case, we would identify that case as contact, isolate them or quarantine them, isolate if they are positive, quarantine if they are negative, I mean they don't have symptoms. So that was a strategy that time. But now really counting every case of COVID really is not necessary. And I saw that very recently there was a uptick of COVID cases in India and also globally several countries reported increase in cases. Of this virus. So these studies, the main study I would say which will be starting very soon.
The last question, sir, about the COVID itself, the spread on India, the things, how we are controlling it and what the process we are doing to control the attacks.
See, in COVID, I mean, we really don't need any further vaccination, and that has been made amply clear by the Ministry of Health and all the state agencies that there is the number of cases is really not high enough to warrant any vaccination. We also don't know whether the current vaccine would be effective against the newer variants because of the escape of immunity that is generated by earlier vaccine. So I think one should really the preventive measure that one should take is about cough etiquette, hand hygiene, and ensuring that if you are ill, don't go in public spaces so that you don't spread the infection.
Thank you so much.
Thank you.